So as a county, we can be more strict than the state order, but we can't be looser than the state order. And this was pretty straightforward until early May, when the state published its resiliency roadmap. And the state has been opening things up at a pretty brisk clip. So for the most part now, many of the parts of our county order are more restrictive. This has been challenging, both to communicate to the public what's allowed and what's not allowed. And it's also been challenging in that it's difficult to articulate the why, because the state is opening things at a very brisk clip, not waiting to see what the impact is. And so that's been challenging as well. But as far as what we can do in the county, it's basically like looking at a buffet. So the state may lay out a buffet. You can pick from these things, but you can't yet pick from those things. And then we as the county can go to the buffet and say, this is what we think is most health protective at large for our community, and then we adopt those and make them clear in our county order. What I also want to say about going slow and how what we may be doing differently here in the county is that when we make a change and we open a sector, so for example, when we opened curbside retail, logistics and manufacturing, we had very clear social distancing protocols, and we gave businesses some time to read them and to implement them. Because when we have our community, our businesses open, we want the workers to be safe and to be protected, and we want the customers to be safe and to be protected so they can feel good about shopping and do so safely. And it takes a little bit of time to put those details into place.
Just a follow-up question on that, because I think that a lot of businesses may have questions, and why is it important to give them that guidance? I know that you have made a point of doing that.
Right. Well, there's still so much that's unknown about coronavirus, and there's so much that's unknown about the risks, and people need guidance that's specific. How many people can be in a space? How long can they be together? What do they need to do? How can they interact? What kind of face covering do they need to wear, et cetera, et cetera, et cetera. And so the more specific that we can be in our guidance, or actually our orders to businesses, our protocols that they need to adopt, I think the easier it is for people to follow along. So it both takes time to develop the guidance, as well as takes time for businesses to put their plans into place to implement it.
A couple of more questions. One area that I know is really important to parents and members of our community is the schools. And I know that you have worked very closely, continue to work closely with the superintendent of schools. So can you tell folks a little bit about what we're doing with respect to the prospect of opening schools, how we're approaching that effort?
Yeah. So schools are incredibly, incredibly important. I would say vital fabric in our society, and I think that the distance learning has been closure of schools, but also in the planning for how can we reopen schools. And we actually have new staff on board in the public health department who are solely dedicated to working with schools to work through all of those different trade-offs and think about how might we most safely get kids back to school and resume something resembling a normal educational experience for them.
Well, thank you. I know that a lot of parents will appreciate hearing that. One last question about the heat. And we were talking earlier as we were walking over to the studio that it is hot. And I know that you have been very concerned about making sure that there are options for people. We notify cities that the public health order allows cooling centers to be open. Anything you want to say about that? I know that
Yeah.
for a lot of folks that's a challenge because it gets so hot in Santa Clara County.
Yeah, so we are experiencing a heat wave, and we know that many homes and residences in our county don't have air conditioning, and you can't stay and bake in your home, and you need to get some relief, and you need to go to a cooling center. So this is all about trade-offs and balancing harms, but during a heat wave, it is important to get to a cooling center if you don't have another way to cool off. And we have opened cooling centers. There's nice detailed guidance from the Centers for Disease Control and Prevention about how to do so safely and how to maintain social distancing within a cooling center. So it's hot, and we do encourage people to seek relief at a cooling center if they don't have a way to do so in their home.
Last question related to that, and I know that the state order doesn't allow for that right now, but pools, public pools, I know that we're trying to get more information from the state.
We are. So again, one of the challenges of the state order is that some things are not on the menu. So for example, pools at the moment are not on the menu of things that we're allowed to pick. We are anxious, especially when it's hot, and also as a form of exercise. Many people cannot exercise, need to exercise for physical health and for mental health, and a pool is a great way to do that. So we have a lot of ideas about how we could reopen pools safely. At the moment, to the best of our knowledge as of this morning, they're still not allowed under the state order, but we're going to work hard and see what we might be able to do.
Well, Dr. Cody, thank you for taking the time to have this conversation with us. I know that there's a lot of questions that people have, which is why you wanted to have this and give this opportunity. Any parting words to the residents of the county and people that are out there watching?
What I want to say to everyone who lives in our county is really thank you. And I know that this has been extraordinarily hard. There is no one that has been untouched. Some people, it's been much harder for some than for others, but it's been hard for everyone. And for the most part, people have hung in there to protect their families and their communities. And it's pretty amazing what our county has accomplished. So I look forward to being able to gradually reopen and for Santa Clara County to be a safe place.
Thank you, Dr. Cody. Thank you to everyone for watching us. Please stay safe, stay cool out there. Thank you very much.
Thank you.